Vaccine emergency rooms are the only place to treat the country's most severe cases of coronavirus.
And when ventilators don't work, doctors at Harborview are turning to another machine as a last option to save lives. Only on KOMO, Patrick Quinn takes you inside the ICU with the story of one nurse turned patient whose life now depends on this one device.
Inside the ICU at Harborview, doctors know what Kurt needs.
Yeah, he needs fluids. Yes, fluids.
Yes, fluids.
A rigorous treatment plan, fluids for the body, rock for the soul.
He's a 70s kind of guy.
Leonard Skinner and Led Zeppelin keep Kurt company, but it's this machine that's keeping him alive.
This is really our last best option.
ECMO, or extracorporeal membrane oxygenation. It's a pump that takes blood out of the body, acts as the lungs and heart, pumping oxygen back in. For Kurt's wife, Kathy, ECMO was the only option.
The only chance he had at life was the ECMO machine.
Kurt is an ICU nurse himself who treated COVID in Kirkland during the peak of our region's outbreak. In late April, after testing positive, Kurt found himself in his own ER as a patient. He wasn't taken to the ventilator. Kathy weighed his fate as the father of 4 was crashing.
The option was not put him on ECMO and let him die, or put him on ECMO.
His hospital didn't have one. Only few do, but Harborview did. With a novel coronavirus, doctors are finding new ways to beat it. And with COVID patients with severe lung damage, ECMO gives those like Kurt a chance.
The 4 that we have on now, I would say without ECMO, most of them would not be alive.
Patients are on ECMO for weeks at a time.
Hey, beautiful.
Kathy calls in daily.
It's almost like I was there, but not quite.
Kathy said Kurt is having a hard time staying sedated, and his heart rate routinely spikes.
You know his chances. What are they?
I think probably the best anyone can give you on this earth is 50-50.
That aligns with the numbers nationwide, where 156 of 314, or 49% of COVID-19 patients on ECMO have left the hospital alive.
Okay, what's his hemoglobin?
But ECMO is just a bridge. It won't repair a lung, just takes over for one, allowing it to recover. On Friday, some hope. After 3 straight negative tests, Harborview let Kathy in, a chance to see Kurt in person, hold his hand, and whisper a few words for only them to know. While he rocks out and recovers, back home, Kathy said their family is leaning on their faith, a devout belief in greater powers above and the one pump below.
And I feel in my heart that there's a really good chance he'll get back here. But I also know that he may not.
Fife is behind bars tonight, charged with 2 counts of attempted murder in the first degree. Prosecutors say she tried to strangle her 2 young children to death. KOMO's Kara Kosinich reports the kids are being treated at Marybridge Children's Hospital, where the little girl is in critical condition.
In Fife just 24 hours ago, a neighborhood filled with families stunned by what was unfolding.
To hear that something happened to some children is pretty concerning and sad.
Court documents say 31-year-old Hina Sedina called 911 on Sunday, saying she had just killed her 4-year-old daughter and her 2-year-old son was next. Documents say police found both children unclothed and wet in the bathtub. Documents say the girl was completely limp and not moving.
The officers immediately began providing medical treatment to her. She was not responsive upon initial contact. They began life-saving breathing medical attention until Tacoma Fire arrived on scene and took that over.
On the 911 call, the dispatcher asked the mother why she wanted to take her children's lives. Court documents say she said this: "I am a bad mother and I cannot take care of my kids."
It's baffling to us, or it's baffling to our investigators. It's baffling to the father at this point. We're not sure why it took place.
Police say the children's father was at the store when the tragic event unfolded. The mother told investigators she could not do anything for her children and they were not going to contribute to society, so it would be better if they die. Tonight, as the little girl fights for her life, so many are trying to understand why this happened.
In my 32 years of law enforcement, we've never experienced anything like that in our city.
Casinos are back in business tonight as they bypass the governor's phased-in reopening and welcome back guests with new safety measures. KOMO's Joel Marino's live outside Emerald Queen and Fife with a look at the crowds still waiting for their turn to enter. Joel?
Oh, Mary, we'd take you right up to the front door, give you a look at what's going on, but we were asked to stay off the property. Still, though, you can see in the distance where people are lined up for their turn inside. That line actually extends far, far back. The casino is limiting the number of people who can get in at one time, and they're taking many other measures to try and keep people as safe as possible. The day started out with a surge of people ready to get out of the house and take their chances at the slots and tables. And the crowds have been coming all day long.
Oh, it was okay, man. I enjoyed it. A lot of people in there.
Maurice didn't want to give his last name, but he did share how different it was inside on the gaming floor.
They're very thorough. They give you gloves, there's sanitation all over the place, and they're wiping the machines down. Every time I look around, somebody's wiping.
Safety changes include temperature screenings at the door, requiring 6-foot social distancing, wearing masks inside, regular cleaning, and limiting the number of guests at one time to 30% of capacity.
It just feels a lot different, but it feels good to be back here.
Aside from Emerald Queen, Little Creek in Shelton and Redwind in Olympia have also restarted operations. All of them also rolled out new COVID-19 safety measures and saw big turnouts as a result.
Things are going very well, and we have a lot of happy guests.
Governor Jay Inslee has asked tribes to hold off and follow the state's lead, but he ultimately has no authority over tribal lands. The people who turned out say it's time to get things opening up again.
We need activity. Not only that, we need movement, man. The economy's going down. As long as we're moving, everything will be back in shape.
Clouds hung over Mount St. Helens this morning on the 40th anniversary of the eruption that forever changed the face of that mountain. 57 people died, and seismologists warn another eruption like it could happen again in our lifetime. KOMO meteorologist Abby Akoni explains how they hope to improve on predicting these natural disasters.
This morning's violent eruption has killed at least 5 people.
This terrifying apocalyptic scene is forever seared in the memory of so many, including David Rubio.
The lightning just 8 or 10 streaks was going from the ground up to the clouds.
Seismologist and former UW professor Dr. Steve Malone was one of many experts who had been tracking warning signs of the eventual eruption for months in advance. He says there's a real threat for another eruption in the decades ahead. After all, there are 5 big volcanoes in the Washington Cascades, including Mount Baker, Glacier Peak, Mount Rainier, Mount Adams, and of course, Mount St. Helens.
The one we think is the sort of the most frightening in many respects are what are called lahars, or volcanic mud flows that can travel down valleys and be totally devastating to anything within that valley.
While seismologists I talked to say scientists will likely never be able to predict future volcanic eruptions with a great level of accuracy, better monitoring stations on our volcanoes can help. While experts say there's an adequate number of volcano monitoring stations out Mount St. Helens and Mount Rainier, more are needed on other Washington volcanoes like Glacier Peak. The director of the Pacific Northwest Seismic Network at UW says we cannot forget the message that Mount St. Helens communicated all those years ago.
Their mountains are beautiful, but they also have the potential to create these hazardous eruptions.